Coronavirus is a large family of viruses known to cause illness, ranging from a common cold to more severe clinical manifestations, such as those seen in Middle East coronavirus respiratory syndrome (MERS) and severe acute expiratory syndrome (SARS). A new coronavirus, COVID-19, was identified in 2019 in Wuhan, China. It's a new type of coronavirus that had not been identified in humans until that day. The rapid spread of COVID-19, a new strain of the coronavirus, has caused a health crisis that defines our days and has turned our entire world upside down. Overnight, this virus has changed our routines and the way we work, as well as the way we communicate with our friends and family, while dealing with illness and even the loss of close people. But how did we get into this situation? What can we learn now from scientists and experts in the field? Recently, personalities such as the Spanish Minister of Science and Technology, Pedro Duque, and prestigious scientific media such as the journal Nature have supported that these coronaviruses had an animal origin, which contain components very similar to the virus that develop species such as bats and pangolins. There is a lot of news that claims that the COVID-19 is a virus that passed from animals to humans in a market in Wuhan, China. But how is it possible that this has happened? In this documentary, we will provide information about its treatment and transmission, as well as the points that puzzle the doctors and scientists who first encountered patients infected with coronavirus. The recent outbreak began in Wuhan, a city in China's Hubei province. Reports of the first cases of COVID-19 began in December 2019. Coronavirus are common in certain species of animals, such as cattle and camels. While transmission of coronavirus from animals to humans is not common, this new strain likely comes from bats, although one study suggests that pangolins could have been the origin. However, it is unclear exactly how the virus spread to humans. Some reports trace that the first cases to a seafood and animal in market in Wuhan. It is possible that from here, SARS-CoV-2 began to spread to humans.
Hi, I'm going to talk about symptoms and consequences of COVID-19. COVID-19, or also known as coronavirus, has affected each person in different ways. The most infected people have mild to moderate symptoms and recover without the need for hospitalization. The most common symptoms are the following: fever, cough, fatigue, loss of the taste and the smell. The less common symptoms are throat pain, headache, diarrhea, skin rash or discoloration of the fingers and the toes, red or irritated eyes. Serious symptoms are the follows: difficult to breathing, the loss of mobility, speech, or feeling confused, and also chest pain. It is recommended that people with mild symptoms and with good health stay at home and do instead to risk immediately medical attention if they develop several serious problems or symptoms. There is an average that infected infected people begin to symptoms within 5 to 6 days after infection, but it can take up to 14 days, more or less. The consequences that the coronavirus bring it are common signs and symptoms that persist over time, including fatigue, shortness of breath, cough, joint pain, chest pain, um, problems with the memory, the concentration, or sleeping, like insomnia, muscle and headache, palpitations, loss of the smell and the taste, as and although coronavirus is considered a disease that primarily affects the lungs, but it can damage many other organs as well, including the heart and the brain. Isolation and the social distance on a psychological level carry risk because they awaken feelings of certainty, fear, despair. Uh, they cause mental disorders such as anxiety and depression, symptoms such as insomnia, like I said. And it is important to remember that most people with COVID-19 recover quickly, but the potentially long-lasting problems make it even more important to reduce their spread by following precautions.
Hello teacher, my name is Daphne. Next, I will mention some recommendations to prevent the spread of COVID-19 through this tip. Keep a safe distance from other people at least 1 meter even if they don't appear to be sick. Wear a mask in public, especially indoors or when it is not possible to maintain physical distance. Priorities open, well ventilated spaces over closed spaces. If you are indoors, open a window. Wash your hands frequently. Use soap and water on an alcohol based hand sanitizer. Get vaccinated when it's your turn. Follow local authority vaccination guidelines. When you cough or sneeze, cover your nose and mouth with a bent elbow or a tissue. If you are not feeling well, stay home. In case you have a fever, cough, or shortness of breath, seek medical attention. Call before going to your healthcare provider so they can direct you to the right medical center. In this way, you will protect yourself and prevent the spread of viruses and other infections. Mask. Properly fitted masks can help prevent people who wear them from spreading the virus to others. However, they do not protect against COVID-19 alone, but must be combined with physical distancing and hand hygiene. Follow the recommendation of local health authorities. In conclusion, although this pandemic has its own characteristics in many respects, useful conclusions can be drawn about previous economic crises, for example, the global financial crisis and other epidemics, for example, avian and swine flu, severe acute respiratory syndrome, the Middle East respiratory syndrome, or the Ebola virus disease, with respect to which it is worth highlighting the great importance of employment, social protection, and social dialogue in the framework of the policy of mitigation and recovery. COVID-19 can use a serious condition of the cardiovascular system. Patients with cardiovascular risk factor or with established cardiovascular disease are particularly vulnerable population with a very significant increase in the rate risk of complication and mortality. Finally, education and training systems around the world and across the Union have been affected and under pressure never before due to the COVID-19 pandemic, which has dramatically changed the way we learn, teach, communicate, and collaborate in our education and training communities. And among them, this has an impact on students, their families, teachers, trainers, the management of the center, and schools in general. Thank you.